be able to present to you in this international conference. And because my topic actually is about the technologies, and I think I do understand that a lot of meeting and speakers are about the techniques, and I think we will take you through a very interesting journey in this short 30 minutes. So what I'll be telling you is what we are trying to do as an MD PhD, and we try to develop different technologies since 1992 through 2020. And I'll also tell you, brief you about my personal vision about what's the future of the aesthetic surgeries. These are my disclaimers. These are some of the companies I have, and I have shares. And I think to live and look young forever is the human's dream. Okay, I mean this is a long time in history, nothing new. But it's also very usually being talked about all the time in the Western and the Chinese media. But I'm a craniofacial surgeon in terms of my background before becoming a facial plastic surgeon in focusing on aesthetics. So in the early days of my career, I do a lot of endoscopic forehead lifts. So when I returned to Taiwan about 25 years ago, there's only 6 plastic surgeons in Taipei. So I did about 500 cases just very quickly in a couple of years. So this is what we do, okay? Endoscopic forehead lift. And after that, we went into the facelifts. And again, the same way, in a couple of years, we could easily collected hundreds of cases. And the technique I use is extended suprapartismal plastic type of facelifts. This is the type of results I can get, okay? Those slides I've been using it for more than 20 years already, okay? So, but quickly I realized one thing, okay? This is, I think, the only take-home message I want the participant today to realize. The take-home message is to look younger, okay? That's what facial plastic surgery do, right? We make people look younger, but that's not really equivalent to making people look young, okay? This is a very important thing. And our job is really not only to make people younger, we want them to look young, naturally, in a natural way, not a surgical outlook. So that forced me to go back to the lab and try to study what really happened for a very useful skin and become an aged guy like that in merely 50 years of time. And these are then I go back to the bench. These are the only 2 guidelines we had back in 1994 when I was teaching in University of Pennsylvania. I'm the first guy who, Dr. Whitaker gave me the mission to talk about aging, and this is the only 2 principles. One is aging is 2 types. One is genetic and epigenetic. The other thing is aging are form and function, and we need to give a 1-hour talk on that. But the technology keep on to evolve, and because of the invention and discovery of stem cells and become popularized. So we have more and more tools in our basket. But what we are trying to do is really, in terms of, because I have a chemical physics background. So this is the way I look at aging, okay? This is the young, old. So aging, when you're young, you have a clean environment. And when you're old, you have a dirty environment. The number of the cells become less, and the cytokines also become less. So in 2002, the adipose derived stem cell was discovered. So that made it very feasible for plastic surgeons to get involved with stem cell research. So the idea at that time is, if we want to make the old become young, so we just take out the cells from the fat, then we culture them outside of the body and put it back. So that's the very simple idea. So we established a clinical protocol intraoperatively, and with laboratory testings to confirm our results back in 2003, okay? And we also set up a company to process the adipose stem cells for the doctors. So these are from 2005 or something like that. And after that, we process it. We do not inject the fat, we only inject the ADSC alone. So because not everybody wants to have a larger volume in terms of the face. So this is the type of result we get back in about 15 years ago. Okay, so you can see that this is not a facelift result because of the injections of the ADSC into the skin. You do see some rejuvenation effects. So a natural consequence is that we begin to inject the ADSC into the scalp. And you can also get some clinical results. These are the area which injected ADSC. These are the control area. So you do see some results. But although surgeons always select to operate, but if you look at the trend of the aesthetic market, definitely is leaning towards getting less and less invasive and more business-like. Okay, so because not everybody wants to get this the tooth surgery, so the next concept we got is instead of injecting the cultivated ADSC into the face, we begin to collect the cytokines and use and inject them. And we did a lot of experiment with the academic Seneca, and this concept was getting a couple of awards by different business competitions. So the type of result we can get with the ADSC is you can see the useful effect of the ADSC cytokines. So these are, and you can heal the wound very quickly. That was from here to there. You can close the wound in about about one and a half hours. That's the type of effect you can get. You can see the whitening effect of the skin, and you can also see the melasma was a little bit improved, and you can see the acne can be improved too. These are and also for the hair. But if you do a lab test, and everybody knows that only the molecular weight less than 500 kilodalton can pass through the skin. Okay, so we are struggling to try to get something more and more effective to deliver the cytokine into the face. So back in 1994 at UPenn, we initiated a project about using 3D to measure the surgical results. And back in 2014, because of the release of the 3D printing pattern, we are able to begin to use the technique to print out a mask. So original idea is that using a mask, and then you apply the cytokine and using a mask, so you sort of accelerated the absorption rate of the cytokine. But this is the first time I wear the mask, but you can see that now, don't worry about the change in skin. You can see my jowl in this area actually improved very quickly in about a few minutes. So at that time, we just act like what we are doing really make a difference, okay? So we begin to create foam shaping devices, okay? So because of this, we went into a lot of studies about the physics and the potential mechanism of these technique. However, these are probably not what we should be talking about during this conference. It's very complicated physics. So this is a clinical example. She is about in her mid-40s, and this is the 3D scanning results. And we have a technique to measure the movement shift of the facial tissues. So by doing those analysis, you can detect the area, which is the area in the green color means that there was no tissue movement, there's no sagging. And the area in the blue and in the red are areas the tissue is sagging. And based on that, we will design a mask and custom made for the patient. And we ask them to wear 30 minutes every couple of days. So this is immediate result back in 2016. You can see that in about 1 hour, you can see some facial improvement. So the technique is pretty much like this. So we do a scanning, they do an analysis, you do print out a mask and give it back to the patient. So today we have already more than 2,500 patients which use the mask, and some of them are doctors, and these are just some of the clinical data. And this is our #1 customer for the facial mask. And she is a model from Bay Area. And from this to that, it's only in 6 months without any surgery or aesthetic medicine. So these are some of the results we can get. And the lower photos are the sequential changes of the face. So you can see some tightening, you can see some lifting, and some molding in the lower face, and the rejuvenation in the overall. So these are, the next thing is that people are going to ask me, how is the effect of the mask as compared to the effect of the surgery? So I have a couple of cases here. These are the patients I did a surgery. I did a facelift on her. Then she became older, then she don't want to have another surgery. So we put her on the mask. So in other words, that these are the after the surgery, so before the mask. This is after the mask. So you can see patient wearing the mask after the surgery. At least from these couple of cases, you can see they are actually growing younger after the facelift, which is very interesting phenomenon. So these are the other cases. So again, this is after the surgery. This is after the mask. Okay. And again, this is after the surgery. This is after the mask. Okay. So another thing is that you probably realize that some of the literature in the facelift, they're saying that the movement of the fat or volume in the deep plan surgery is about 3.2 cc. And we have the technique to compare the movement shifts of those patients who wear a mask. We can come up to about almost 2 cc of volume shift after wearing the mask for several months. So is facelift with a mask possible? I don't think, I'm not sure, okay? But what I think is using a assistive device after the facelift should be and could be quite important. So we have begun to promote the mask all over the Asia area, and we got some pretty good response. And we have companies in probably 4 different Asian countries now.